It was a busy day in the hospital. I was rushing between patients, juggling medications and orders. In the blur of activity, I made a mistake. I was disposing of a used needle when it happened. The sharp point pricked my finger. A jolt of fear ran through me. Needlestick injuries are an occupational hazard for healthcare workers. We know the risks. We know the protocols. But in that moment, all I could think about was the potential consequences. My heart pounded in my chest. The tiny puncture mark on my finger seemed to pulsate. I knew I had to act quickly. Every second mattered. I immediately squeezed the wound to encourage bleeding. This helps to flush out any potential contaminants. Then I rushed to the sink and washed my hand thoroughly with soap and water. The next step was crucial, reporting the incident. I notified my supervisor and the occupational health team. They would guide me through the necessary procedures. The occupational health team sprang into action. They took detailed information about the incident, the type of needle, the patient it was used on, and my vaccination status. Blood was drawn from both me and the patient for testing. This would determine if there was any transmission of bloodborne pathogens such as HIV or hepatitis C. I was offered post-exposure prophylaxis, PEP, a course of medication that can reduce the risk of infection after a potential exposure. I readily agreed, knowing it was the best course of action. Section 4. The waiting game. The days that followed were agonizing. The results of the blood tests took time to process. Every moment felt like an eternity. My mind raced with anxieties. The uncertainty was the hardest part. I knew there was a chance, however small, that I had been exposed to a serious infection. The thought of the potential consequences weighed heavily on me. Section 5. Relief and reflection. Finally, the results arrived. They were negative. A wave of relief washed over me. The weight of worry lifted from my shoulders. The experience, though frightening, was a stark reminder of the importance of safety protocols. It highlighted the need for constant vigilance, even in the midst of a hectic workday. I knew I'd been fortunate. Not all needlestick injuries have such positive outcomes. The incident solidified my commitment to upholding the highest standards of safety in my practice. Section 6. A call for vigilance. My story is a call to action for all healthcare workers. Needlestick injuries are a preventable risk. It is our duty to protect ourselves and our colleagues. We must strictly adhere to safety protocols, using safety-engineered devices, disposing of needles properly in designated sharps containers, and never recapping used needles. Education and training are paramount. We must stay informed about the latest safety guidelines and best practices. By prioritizing safety, we can create a safer work environment for everyone.